Hi, this is Dr. Saxena, and I've been talking about one thing which is called environmental medicine. And in this segment, I just like to discuss from a few of the things which we try to look from a pediatric perspective. So often, it happens that someone comes to us for a simple problems. It can be as simple as a child of 10-year-old. um, he comes to the clinic complaining of headache, and his mother of course says this guy never had headache. And so what are the environmental etiologies uh, are there in my differential diagnosis? What are the questions, what are the things background I'll be asking, I'll be looking from this KYC from this patient. Like I happen to see a child in the sense around 18 years old girl. Mother also came along with the child, and she was concerned about the overweight of the child. And she read in one of the social in the news, something like that, the chemicals which are there in the shampoos and the other personal care products, are that a reason for her to become overweight? I really I think people have started understanding what is the role of this environmental chemicals which are causing problems. And this is a big thing. The children of that age having this particular thing called multiple chemical sensitivities, or migraine, suffering from migraine, or something like this child who is obese and he's having some hormonal imbalances and all that. And the best part is the parents are they are understanding about what is the environmental health. We are talking about something which is impacting your health, which you are using in a day-to-day life, which is responsible for the outcome. So we'll be talking somewhere on what is this urban air pollution, what are the indoor air pollution, what is the unsafe water, what is poor sanitation and hygiene, what is this thing called climate change and acute poisonings. So these are the trends basically. What happens here is, compared to the adults, the children generally are more susceptible for adverse health effects of these environmental chemicals. And they children receive proportionally larger doses of toxicants. So they absorb things quite. See, when we had worked on the lead also, we know that child absorbs leads more than the adults. So the organs and the tissues are rapidly developing, resulting in greater susceptibility to the chemical insults. So because of these organs and tissues are rapidly developing, they just accumulate more kind of these environmental hazards. And this is somewhere more prevalent in the developing countries than the developed countries, but still we could see in the developed countries also. What I'm talking about indoor pollution, I'm talking about some solvents and all that. These are always, it's on a very high rise. So we ask, when this kind of patient comes to us, I typically ask about the child's surroundings, what is the kind of paint you make in your home, in the sense what is the walls are, what are the furnishings you just keep it inside the home, because everything is important for us. And what is the advice I would like to give will be based on the what is your this one, how you are practicing this healthy environments. And I'll be asking for I'll be asking what is the kind of water you are using, and also simple things will be working on that. So by once we go into this particular problem, we just want to know what is the source of this environmental pollutants, what are the source of these chemicals, so that we can always put a first stop to that ongoing toxicity. Ongoing toxicity means you need to see that if the child is getting headache after using some kind of incense sticks in the home. Mother uses some incense sticks to after puja or something like that. The child may get a headache. We need to correlate whether this particular thing is causing that, or someone else uses a deo or air fresheners. What is that particular thing? So there is a correlation between your environmental place where you stay, what are the things which have been, what is the kind of wash also, in the sense you try to floor cleaners what you are using, and based on that we try to work on that. So I mean, like we just as physical surroundings, we just like look, we look at something, is there any tobacco smoke exposure because of second hand or something like that, we need to know. I'll be more inquisitive about water sources, whether it is a borewell water or well water, or you are taking that bottled water, plastic bottled water. I need to know that. What is the kind of foods they take? What is the kind of split? What if somebody is getting every frequently Monday morning, he's having headache, I will assume that he must be taking something on Sunday or Saturday, and maybe that must be causing, that food must be related with this particular problem. Other thing is what is the kinds of household members, and is anyone is onto painting, or is anyone into so what happens is that this causes some outgassing, which is the reason we look into all these things. So we try to look at again, first thing is the lead paint. Lead in the paint is the one thing which you are concerned about. The other things are air pollutants, and we are talking about carbon monoxide, heating sources, allergens. There are a lot of toxic chemicals which are from they keep outgassing because of the pesticides what we have done some time back, or because of this wooden furniture, the flame retardants and all. And you need to look at what is the child having a problem with the school, what is the paraphernalia in the school, which is the dust, all that particular thing, chalk piece, and a lot of new fresh paint in the schools are really a problem for a lot of children who are chemically sensitive. And I can always tell you, this chemically sensitive patients are increasing day by day. I do see multiple chemical sensitivities in my practice, right from the childhood to the adults. And I know what exactly is this, and I can always tell you, people come to us, and we try to take the history about, you go for a weekend getaway, and you go and stay in your any kind of staycation, anything like that. And once you come back from that, what happens is that you go to a resort, you have where the resort is perfectly, it's a kind of to maintain the greens and lawns and all that. They use a lot of weedicides and herbicides. It's like like they use a lot of DDT still, I have seen. So I had seen people after coming back, I himself I have understood. So once you are back from that resort, and there are a good number of resorts, and people definitely like to go and get into resort for a day or two and come back. And after that, what you see after next 2 or 3 days, you face the music, and you start. This is purely related with the chemicals, what you have been subjected, what the chemicals which was sprayed in that particular lawn and all that. You get that in the, so these are all the things which we would like to know, what exactly is causing a problem with you. So this toxic exposures, and we had when I'm talking about this, I had a case. We came all the way from some 300 kilometers from 500 kilometers from this place, and the parent came with a child who was who took a rodenticide, which was written thallium was there. This is a rat killer poison was thallium, and this man was like He said that bottle was open and he doesn't know what happened to the child. He has taken himself, or so this is kind very frequently come across, and we started working on that particular case, and luckily he didn't get into any problems, but we were able to there were a lot of signs of intoxication, and it seems he has this child has opened it, and the fumes he got inhaled, and he got into something like thallium toxicity, and we were not directly testing his all thallium things and all that. This was an acute toxicity. I tried working in a different way, and the child is this is week 4 is doing phenomenally well. These are the things which I had. It's metal toxicology, like have in my practice. I try to look into all this stuff. I had seen regarding to the case I was telling about. One thing I shared one was the migraine patient, in the sense he had a headaches. The child, 10-year-old child, had a headache, and the ones we tried telling them, okay, you need to take out all these chemicals. No, you don't use air fresheners, and there is no need for all that agarbattis, incense sticks, and all that. And they understood, the family understood, and the child is absolutely symptom free. He is not on any kind of drugs now. Other case was a 18-year-old teenager, and she was obese, and we later found out she had PCOD also. So right, we had to work out a program for her, detox and all that. Tried doing some simple stuffs, and again the results are really good. Simple stuffs is trying to do a detox, trying to follow a diet, and see that there are no more toxicity approach. And I'm very happy with the outcome of this child, who is about 10 years old, who has inhaled the fumes of rodenticide, which was written thallium. And the person who brought me, the father, he read everything in the net about this thallium, and he was really pissed now that almost the child is I'm quite so I thought I'll just share you that particular stuff. This is what we try to work on, this thing called integrative medicine, and this is what I mean to say by I need to look at the environment where the child stays. What are the things he has been exposed? These are the things which are very essential, so that we can always stop at this particular thing. Because what happens is that the child starts, you put a suppressing any kind of symptomatic treatments. He goes from pillar to post, going around places. So once you understand what is it, and this is the thing which I have to offer, and thank you.